Welcome to Morning Report Top Stories, a selection of news from Radio New Zealand National's morning news programme.
A woman who regularly visited a young relative at an Oranga Tamariki facility in Christchurch says she was concerned about the way children were treated there. Te Oranga has been closed as an investigation is underway into abuse uncovered by the news website Newsroom. Kath Costa says she often visited Te Oranga.
When I first went there, I was quite surprised because it was like a jail. Everything was lock and key from the time you went into the front door through to the next stage. To visit the person that I loved, we were pushed off into a room to be able to have conversations. While I was there over that whole year period, because I was in and out for a year, there were children that would get really distressed. You would hear them yelling, you would hear staff yelling at them, and it was over simple things like a child had got wet, wanted a towel, they weren't going to give it to them, the child lost control, yelled, screamed, and the staff would move them away. The particular person that I loved, he really struggled with it because he was one of the older children there, and through being institutionalised, he was used to being in solitary. It was his way of coping. And so from that point of view, it meant that there were times when he would manage himself and there were times where he'd put himself into security to be able to just get himself away from what he was having to deal with. And from that point of view, you know, I would go into his room and have a look at it. His room would be messed up, everything would be all over the floor, the curtains would be shut. The toilets had no doors on them. I witnessed going to visit this child with marks all around his neck, and when I had asked him what had happened, he told me that he was restrained. I made a complaint to the staff that were on there at that particular time because I couldn't understand by restraining a child why he would have marks all around his neck.
And that was Kath Costa, who regularly visited the Te Oranga unit in Christchurch.
The government offered to pay millions of dollars to Rio Tinto just months after it promised no direct subsidies would be paid to the owner of the Tiwai Point aluminium smelter. The deal, which was never taken up, is revealed for the first time in letters released under the OIA. The Finance Minister is not calling it a subsidy, saying in return for the money, the multinational was expected to retain jobs, clean up the site and help the Southland economy transition to other industries. RNZ reporter Phil Pennington has been going through the letters and is with us now. Phil, kia ora, good morning. The government has been very strong on not giving a subsidy to the smelter.
Yeah, very strong indeed, Susie. I mean, it was embarrassing back in 2013 when the National John Key's government did give a subsidy, $30 million to the smelter, and both parties have subsequently said they would never do that again, never repeat that. The background to this is that Rio Tinto was urgently seeking a deal last year to get a big cut to what are called its transmission charges, what it pays for power line delivery. They were paying $60 million a year. They wanted that cut, and they were in these negotiations with the government, which are charted in some of these letters. Labor's election policy was that Transpower, the state-owned lines provider, would negotiate this deal to get the smelter to stay on another 3 to 5 years. No direct taxpayers' money. Rio Tinto saying no deal. Or if there's no deal, we will go by this year, by this August. In fact, in September, while campaigning in Southland, Jacinda Ardern said, we have said we do not believe we should be giving a direct government subsidy to Rio Tinto, so that's not what we will be doing. Rio Tinto itself, actually, Susie, expressly didn't want a government subsidy, so it's surprising to find in these letters in early December, Rio Tinto saying to the government, what's up, it seems you're preparing a subsidy.
So what exactly was the offer?
Well, the details, which are in these 25 pages of letters, they show that on 15th of December last year, just 3 months after the Prime Minister was talking about no subsidy, Grant Robertson wrote to Rio Tinto saying the government would provide what he called a transmission transition payment beginning just that next month in January. So the government was ready to go. And the amount, well, it's blanked out, and the minister, he's refusing to give us the figure, saying that's confidential. But it has been previously reported the company wanted about $30 million off its transmission charges, so a fair bit. Now, this payment that Grant Robertson was offering was to run till December 2024. Now, Rio Tinto is given 3 days to respond. When it does respond, December 18th, it basically accepts that offer, but there's a but in there.
OK, there's a but in there. Do we know why and what that is?
Well, the finance minister had laid out 5 conditions to get this payment, mostly around clean-up. Now, in its response December 18th, Rio basically agreed to 4 of those conditions, but the sticky one's the 5th, and that is to commit to excavating the huge smelter landfill. Now, that's going to be very expensive if they committed to that, and Rio Tinto has still not committed to that. Yesterday, it told me it had not decided what action to take over the landfill, and this has toxic waste in it. We've talked about it's threatened by coastal erosion, sea level rise. We also know a new thing, that the transmission deal in whole is now off the table from the government. So no landfill agreement, but within a month of that offer being made in December, in January, the company does say yes to keeping the smelter open, but that's based on a single deal, the deal with Meridian, to get a cheaper power bills. Those 2 deals are meant to go hand in hand, transmission and Meridian. It only gets one of those, but it still agrees to keep it open.
But on the transition deal, as we've said, the government's not calling this a subsidy.
Yes, that's right. Grant Robertson yesterday wouldn't give us an interview. In a statement, he says the government has not gone back on what Jacinda Ardern promised in the campaign. He says the negotiations with the owners were around exploring ways to lower electricity costs for the company in return for firm commitments to maintain jobs at the site, agree to work on remediation, that's the clean-up, and on this transition, trying to get Southland into different types of economies. Grant Robertson's spokesman said the government was seeking certain commitments from Rio Tinto in return for this proposed payment.
Interestingly, though, Rio Tinto does talk about a subsidy.
Yes, that's referring back to that letter of early December where their global head of aluminium, Alf Barrios, he says to Grant Robertson, apparently a fair fixed transmission charge deal has been replaced with an offer of a subsidy payment from the government. As I said, they definitely didn't want a subsidy, and the government had said repeatedly that this was off the table. Now, other government documents that we have show, that other media have, that the Herald reported in April, show that officials had warned that there was not going to be time to do that Transpower deal that we talked about. No time, but also warned that if you did a direct payment, watch out because others might come looking for the same sort of favour.
So why wasn't a deal negotiated through Transpower?
Well, we don't know. We think it's because of this time thing. We don't know that. We would like to see in behind there. What the letters do tell us, in addition, though, is that the tension that was around this, at one point in the negotiations last November, Alf Barrios says to Grant Robertson, so many of our skilled workers are leaving because of the uncertainty around the smelter that we've just had a situation last week where there was urgent instability at the site that created an unacceptable risk to safe operations. That sounds bad. I asked the smelter what was going on. They say, well, that was an electricity, a power supply instability, that is not current now, and that there was no risk to the local community or the environment from that, Susie.
Thank you very much, Ngamihi. That is Phil Pennington, RNZ reporter, who's been going through the letters released under the OIA in regards to Rio Tinto. Many political leaders in the West see China's President Xi Jinping as a dangerous dictator who's scrapped term limits, allowing him to rule the world's most populous country for life. But former New Zealand Prime Minister Sir John Key calls President Xi a friend and says he's literally on the Chinese leader's Christmas card list. Guyan Espiner interviewed Sir John for the new RNZ podcast Redline.
How close is John Key to one of the most powerful and feared leaders in the world? This close.
He calls me a friend, and I think he sort of means that.
So you're a friend of Xi Jinping?
Well, I don't want to overstate. He thinks he might take me off his Christmas card list, but he does send one every year.
In his interview for the Redline podcast, which examines the influence of the Chinese Communist Party in New Zealand, John Key emerges as one of the few Western politicians who are strongly pro-China. He says his closeness to President Xi has given him insights into China's thinking.
I've had the privilege of having a lot of one-on-one dinners and conversations with Xi Jinping, and when you really say to them, what's the dream? What is all this about? And they would say, well, we have 300 or 400 million people in poverty. our big goal is to, this is a bit of a crude way of saying it, but Singapore on steroids. It's to develop the country to a point where they are smart, efficient, lifting people out of poverty and giving people opportunity and hope.
John Key accepts that China has serious human rights issues and believes New Zealand should speak up about those. But he doesn't think that should hinder strong economic relations between the countries.
Some people will say, oh God, the guy's just an investment banker through and through. That's all he's sort of thinking about is money, doesn't care about anything else. And all I'd say to you is I'm not an idiot, But I do think that New Zealand companies and New Zealand employees and New Zealand consumers have massively benefited from this relationship. I don't think we've done that by selling our soul. I think we've continued to stand up for the things we believe in. And I do think that it would be easy for us to drift into the place where the others are at.
That place is the strained relations the other Five Eyes countries have with China. John Key says he remains in touch with the former leaders of Britain, Australia, America and Canada, and they're all deeply negative about China. But he likens some of the more extreme anti-China rhetoric to conspiracy theories.
I'm not a sort of, kind of silver tinfoil hat conspiracy kind of guy. I think that they are what they are. They are a big country that used to have the largest economy in the world, that spent, centuries really on ice. There are many things, but a global force for evil is not one of them, in my view.
You can listen to the Redline podcast now on rnz.co.nz/redline.
Dates for the next 30 years of the new Matariki public holiday have been released at a special ceremony this morning. The date of the holiday will shift each year to align with the Maramataka, the Māori lunar calendar, but will always be on a Friday. The first will be held on June the 24th next year. RNZ reporter Jamie Tahana was at the dawn ceremony at Te Papa Tongarewa and is with us now. Kia ora, Jamie.
Kia ora, Susie.
Tell me a little bit about what the ceremony was like, please.
It's still going. It started well before dawn, about 5:45, and it was led by Rangi Matamua, the Tūhoi famous astronomer, one of the experts on Matariki, and so, pointed out as surprisingly still Wellington morning, looking out across the harbour with the umukohukohusetu burning in the traditional way, the smoke heading up to the gods and things like that. And then Matariki glistened in the northeast sky at dawn of the new year. Karakia was said, lamenting those lost over the past year and sending wishes for the year ahead. And Rangamatama was saying, well, now Matariki is becoming a public holiday. Now it's more to the fore. He hopes more people take part in similar means.
Aye. Now, tell us when these first few dates are, because they're going to be swinging around a bit.
Yeah, so, Matariki itself is defined by the lunar calendar, so it's not like June, July sort of thing. So today, for the first day of Matariki, the moon is in its Tangaroa phase, which is the last quarter. Pipiri is the month, that's the star shining bright and prominent, and then you've also got Pūrina shining bright and Matariki rising again after a month of not being visible. So all these things have to align for the start of Matariki to come. And so that's what Matamua and this panel, the government appointed, has been working out for the next few years. So Matariki, the public holiday, will shunt around a bit from late June to early July. And then now we're throwing in the caveat that it will always be on a Friday. So the first day of Matariki is not always on a Friday, but this is to add some certainty for businesses, Michael Wood, the Minister, says, as well as, allow people to take advantage of a long weekend, support the economy in that sense. So it's combining those things that's determined when Matariki will be, and first one next year is late June. I don't remember the exact date.
June the 24th. Ngā mihi e ho. Kia ora. Jamie Tahana there, our reporter who is at that dawn ceremony still going on down at Te Papa Tongarewa. Fiji hit a new daily record of 431 COVID-19 cases, along with 2 deaths yesterday. There are now 24 deaths due to mate corona in Fiji, with 22 of these happening during the outbreak that started in April this year. Fiji health authorities have said the 7-day average of new cases per day has increased to 285. Christchurch anaesthetist Dr Wayne Morris is in Fiji with the Australian-New Zealand Medical Assistance Team to help with the COVID-19 response. He's with us now. Kia ora, thank you for being with us. What are you seeing in the hospitals over in Fiji and on the ground?
Pulavanaka, Susie. It's a complicated situation here. We've been up to the main hospital in Suva, the Colonial War Memorial Hospital, and that hospital was effectively closed a month ago because of an outbreak of COVID in the hospital. So that's been treating mainly seriously ill and less seriously ill COVID patients. The other big health facility is down at an area of Suva called Suva Point, and our Fijian counterparts, the Fiji Emergency Medical Assistance Team, have set up a field hospital in the Vodafone Arena there. So they are trying to cope with some of the non-COVID patients that have urgent medical and surgical problems.
How is the health system coping with this large rise in COVID cases?
It's been a really sophisticated response by the Fijian health authorities, but I think that this sort of outbreak would stress any health system. So we're obviously very worried about the increasing numbers of cases, and it's fair to say that it is really stressing the system. As I said, the main hospital was effectively closed down a month ago to patients other than COVID cases, and we know that there are ongoing health needs even during a pandemic, so there's still lots of patients with urgent medical problems and surgical problems that need treatment.
The sorts of things that have been put in place by the government to try to curb this outbreak, is it working at this stage? I suppose, are we seeing these rises in case numbers because that is part of the way that it's becoming under control, or is it actually getting out of control?
The Permanent Secretary for Health, Dr. James Fong, said the other day that we're now in a mitigation phase in the central division of Fiji, so that's the part of Fiji that includes Suva and surrounding towns. And what that means is that there is now uncontrolled community transmission, so the focus now is really on managing the severely ill patients and reducing the number of deaths in that population. Other parts of Fiji, so in the west and north and east, have much lower numbers, although there is concern about a smaller outbreak in Lautoka.
On a day-to-day basis, what kind of things are you personally doing?
So the team's been tasked with four things. So one thing is to assess the capacity of the main hospital and assist with reopening that hospital for the non-COVID patients. We've also been asked to support the Fiji Emergency Medical Assistance Team, and they are currently working in the Vodafone Arena, but during the next couple of days the National Gymnasium is also going to be opened, and the plan is to put moderately sick COVID patients in there, and they will be monitored so that if they deteriorated, they will be transferred for more advanced care at the Colonial War Memorial Hospital. So I've been looking at that and assisting local doctors and nurses with the systems and processes needed for that to happen. The other area that's really important is infection prevention and control. So that's the use of PPE and other measures to reduce the spread of infection from within the health facilities. And it's really important that the staff and the patients have faith that these PPE and other equipment are going to keep themselves safe.
Thank you very much. Appreciate your time. Dr. Wayne Morris there, who is in Fiji. He is a Christchurch anaesthetist.
To the US now, Chief Financial Officer of the Trump Organization, Alan Weisselberg, has appeared in court in handcuffs and pleaded not guilty to charges of fraud and grand larceny. He surrendered to New York authorities this morning, facing 15 charges. Donald Trump's business empire is also being charged with fraud. Our correspondent Simon Marks is with us now for more on this breaking news. Good morning, Simon.
Morning, Corin.
So the documents were unsealed. We get a look at what's going on. Is it a big surprise?
It's not an enormous surprise because there had been so many sources reporting over the last few days as to the nature of these charges, but it is 15 counts, one of them carrying a possible 15-year jail sentence for Alan Weisselberg. He's 73. He has spent the last 48 years working for the Trump organization. He knows where all the skeletons are kept in the various cupboards around Trump Tower, and that is why prosecutors are clearly using these charges to try and pressure him to cooperate in their broader probe of Donald Trump's business empire, potentially in exchange for leniency. He is accused of having evaded taxes on $1.7 million worth of income going back 15 years. It is alleged that he was given a tax-free Mercedes by the company. He was given payments to cover the costs of private school fees for his grandchildren. He was given an apartment in Manhattan, all as part of his compensation package. And the district attorney alleges that he failed to report that as income on his taxes, as you would normally be required to do. Now, his lawyers insist this is going to be vigorously contested in court. They and a lawyer for the Trump organization, after Mr. Weisselberg's appearance today, insisted this is a political prosecution and that under normal circumstances, cases like this would not give rise to criminal charges. The district attorney is only doing this, said the Trump organization's lawyer, because of his loathing of former President Donald Trump.
Right, so now we wait to see whether a deal is done, because I guess the choice is that either he flips on the Trump administration, and we know where that can end up for those who have done that, or he goes to jail.
Well, yes, potentially. I mean, were he to be convicted of all counts, he could go to jail. They are obviously hoping that he is going to sing like a canary. The Trump organization seems to believe at the moment that Mr. Weisselberg will prove to be more of a loyal soldier than, for example, Michael Cohen, the former president's former lawyer, who did cooperate with authorities in exchange for leniency in terms of the charges that he was facing. But, you know, Alan Weisselberg has been such a central part of the furniture at Trump Tower for so long that when he first started working for the company, he was actually working for Donald Trump's father, Fred, who was still running the business back in the 1980s. So the Trump family seems fairly certain that he's going to remain loyal to them at the moment, although, of course, once charges are pressed, you can never predict where things are going to head.
Simon Marks, thank you very much for that.
New research has highlighted the serious barriers faced by Māori and Pacifica children when trying to access primary health care. The report was based on an analysis of the University of Auckland's Growing Up in New Zealand data. Access to appointments, locations of services and travel costs were some of the barriers highlighted. Our reporter Te Aorewa Rolleston reports.
Lack of equal access and treatment in the health system is well proven. Yet despite the government working towards what it calls transformational change, a new study shows that Māori and Pacifica children are still bearing the brunt of system failures. Infants as young as 1 to 4.5 years old are at the centre of the new report, further exposing wide health inequities. Lead author of the report, Dr. Mona Jeffries, says it is deeply concerning that children are paying the cost.
I find it really, really concerning. Think about the age of these children. They're 4.5. Most of them will be having health issues that are repeated. So they're things like respiratory issues, skin conditions, those are the most common reasons for being hospitalised.
Access to appointments, followed by needing after-hours care or not having transport, are barriers. There can be extra costs for non-standard visits or children not enrolled at a practice. And there are further expenses for travel and parents getting time off work. Dr. Jeffries says these barriers have major health, social and financial implications. She says primary health organisations should ensure all children who come in for care are enrolled with a practice to qualify for free GP visits.
If you're starting school already having been hospitalised, the chances are you're going to be hospitalised again, and that's going to have a huge impact on their education. It's going to have a huge, huge impact on the families. And of course, it has a big cost implication for the health system. The cost of being hospitalised vastly outweighs the cost of providing GP care or primary care.
Te Whānau o Waipareira Chief Executive John Tamihere says in rural areas the disadvantages can be even worse. He wants funding and services to be pumped into communities and self-run.
We have to change our health model and declutter it and make it more user-friendly. And we've got mobiles ready to go to service our mothers and babies at our decile 1, 2 and 3 schools. We would run those mobiles in the Western region, and we're trying as hard as we can to get that negotiated process through all the powers that be that drive the present health system.
GP and Professor of Hauora Māori at Otago University, Dr. Sue Kringle, says the nature of some care rings alarm bells.
Very interesting to me that Māori and Pacific whānau reported more barriers to care. More of the Māori and Pacific whānau reported higher number of visits, and yet they still had more hospitalisations. And so my question is, what's going on in the delivery of care of those services?
Dr. Kringle says more specific research is needed.
Those children who are going to services despite the barriers, do we have to have a look at what's going on in their healthcare to understand why they're also ending up having more hospitalisation?
Dr. Jeffrey says any changes must align with contemporary interpretations of Te Tiriti or Waitangi to ensure health equity becomes a reality. In a statement, the Ministry of Health says COVID-19 has made addressing barriers more challenging. It acknowledges more can be done to improve health and well-being for the young and says work to improve this is underway.
Well, from earthworms to elephants, new research reveals almost 1,600 species across the world have been eating plastic. The new research published in the journal Science is the most up-to-date comprehensive report of different species plastic ingestion. Co-author of the report, Massey University Research Associate Gabriel Machowski-Kapuska is with us now. Kia ora. Thank you for joining us. We think about marine life perhaps being at risk of ingesting plastic, but how surprising is it that it's not just confined to them?
Good morning, Susie, and good morning to all your audience in New Zealand. Kia ora to everybody, and thanks for the interview and for talking about this topic that is so important. What we did is that, as an international collaboration led by Robson Santos in Brazil, we review all the literature available in the topic, and we found from, as you mentioned there, from earthworms to African elephants, plastics in general, they have been widely consumed. It's been previously thought that it was only marine animals, and what we found is that terrestrial species and freshwater species, in the form of fish, they are understudied, and the problem is more comprehensive than this.
How is it that they're in this situation? Is it that it's impossible to avoid eating plastic for many species?
That's an interesting question. What the evidence suggests is that the animals, they are sort of stuck in what we call an evolutionary trap. They don't have this ability to differentiate the food that they consume or they eat versus plastics. Plastics, they have similar chemical and physical characteristics that they make animals to make these sort of mistakes.
What sort of harm do you anticipate this is doing?
Well, there are four important areas to consider in terms of plastics as evolutionary traps. One is the similarities between prey and plastics. The second one is the massive availability of plastics in the environment. And then the third would be the foraging strategies of these animals. Some animals, they consume wide range of foods and they are prone to consume plastics. And then if animals, they get hungry, they do tend to make the wrong choices, and that's when they consume more plastics.
When you talk about evolutionary traps and sort of ending up having to eat plastic because there's nothing else, is this because, are they essentially starving?
No, they're not essentially starving, but the issue is that when plastics, they are available in the environment at high volumes that they are at the moment, in some areas in particular, animals, they face this challenge of making decisions like we do as humans. And when you are hungry and you can't find sometimes enough food for many reasons, sometimes you tend to make the wrong choices. And that's what, in some cases, evidence suggests that animals are doing.
Naomi, thank you very much. Interesting stuff there. Gabriel Bachowski-Kapuska, Research Associate at Massey University and co-author of that report.
You've been listening to Morning Report Top Stories from radionz.co.nz.